Now that we've discussed what conditions require enteral tubes, we're going to go over the types of tubes you can have. I'd like to start by having you watch this brief video on different enteral tubes.
The type of feeding tube you received in the hospital was determined by your doctor. The decision was made based upon the function of your GI tract and the length of time tube feeding was likely to be needed. Some feeding tubes are appropriate for a short period of time, typically less than 30 days. Others for longer-term tube feeding. A nasogastric or NG tube is inserted through the nose and down into the stomach. This type of tube feeding is typically for short-term use and will not be covered in this program. Please contact your healthcare provider for more information. A nasojejunal or NJ tube is inserted through the nose and down into the jejunum, the second part of the small intestine. A gastrostomy or G-tube is placed directly into the stomach through a hole made through the abdominal wall and into the stomach. This hole is called a stoma. G-tubes can be placed surgically or non-surgically. A type of G-tube placed with an endoscope is known as a PEG. A jejunostomy or J-tube is placed directly into the jejunum through a hole made through the abdominal wall or through an existing G-tube. A J-tube placed through a G-tube is called a J-tube.
So that basically gives an overview of the different tubes and their different points of entry, and that's exactly what determines one type of tube from another. So the first we're going to go over is nasal entry tubes. So there's three that you typically see. One's nasogastric or an NG tube. One is the Salem sump, and then one is a nasoenteric tube. But we'll go over those. So the nasogastric, this tube goes through the nares and it goes down through the esophagus, behind the epiglottis, and down into the stomach. The main reason for using the nasogastric tube is for tube feedings and decompression. Another type of NG tube is called the Salem sump. So this one's different. This one is primarily decompression. Goes down the same way through the nose into the stomach, but this one's usually for taking contents out rather than putting them in. It usually has this valve that you can see over here, the anti-reflux valve, and that's to ensure that fluids aren't going to backthrow. It's basically an air vent. And then you'll see it's got multiple holes in it that allow for the suctioning of stomach contents. Then a third tube is the nasoenteric. Now there are numerous types of these tubes. The Dobhoff, which is shown here, and the Keo feed. These specific tubes have a guide wire that you use to put the tube down. So it's more of a comfortable tube to go down the nose because it's got this soft tip at the end. And once this is placed down the nair, you have to take the guide wire out in order to use it. So different from an NG that you just guide down and then it's good to go. You have to get usually a chest x-ray, but that one's more ready to go. And the doctor usually is the one to take out the guide wire. And then there's also the nasoduodenal enteral tube, and this is simply a tube that goes down your nair, but it ends in your duodenum rather than the stomach. And then the nasojejunal, same principle, except it goes all the way down to your jejunum rather than your duodenum. So once again, these are all nasal entry, and they end in the stomach, or usually the jejunum, but once in a while you get a nasoduodenal that ends in the duodenum. And then I'd also like to go over types of enteral tubes. So these are gastric tubes or post-pyloric entry tubes. There are three main ones, and the first one is the PEG tube, the percutaneous endoscopic gastrostomy tube. This is the one you're going to see most often, and this is the one that most of our patients, when they refer to having a G tube, that's what they're talking about. And then also there's the gastrojejunostomy tube. This is the one that goes, like the video said, in the same way as it goes in the same way as a G tube, but there's a J tube placed through it because they want the tube feedings to hit the jejunum for one reason or another. gastric part, the portion of the stomach needs to rest. And then there's a jejunostomy tube that goes right to the jejunum. It doesn't go through the stomach at all. And then replacement tube. So eventually, for some of these G tubes, you can get. It's called a button tube, and a lot of people refer to them as Mickey buttons, but Mickey button is more of the trade name. And these are just nice little tube. They take that lengthy portion of the tube from the outside of the stomach. We'll take a look at it, and it just makes it so it's more of a discrete method of feeding. And then another replacement tube is a Foley catheter. This is only in the incident that the tube comes out. This is a temporary solution until another G tube or J tube or whatever can be replaced. So the PEG tube, the most common tube, this one ends in the stomach, and this one is also for nutrition and gastric emptying. You can use it for either. For gastric emptying, you'll usually see it hooked up to a Foley bag and kind of just left to drain. And then obviously with nutrition, you're getting tube feedings usually. So as I referred to in the Mickey button, so this end of the catheter, um, the outside portion that's outside the stomach, this is usually isn't here, and it's just a little button that is this little anchor here, and you just hook the tube up and feed. So it's just more of discrete way to do things. It cuts off this end part, which can be a little obtrusive if you're out and about. That would be more of a solution that you would have for long-term feedings. And then you see this retention balloon. This is what keeps this tube in. I didn't mention it with the nasogastric tubes, but those are usually anchored with a piece of tape on your nose. While these, it's very different. These are actually surgically placed, and they're anchored with this balloon and these external bumpers. You usually want a little give here, otherwise you can have some complications, but this portion of the tube goes right through the skin and goes directly into the stomach. This is just a little adapter on the end. The GJ tube, same principle, goes in through the stomach, but this one will come all the way down and end into the jejunum. This one is primarily for nutrition. You don't often see it for emptying because once you're in the jejunum, you're not really emptying gastric secretions anymore. The J tube. So this is, you can see a much smaller tube as compared here. Let me show you. As compared to the G tube, which has a large catheter. So this is a very tiny catheter. It ends in the jejunum. It's basically only for nutrition. And when we get into tube feed administration and tube maintenance, you'll know that you can flush these tubes, G tubes, and get aspirates back. The jejunum tubes, you don't usually get an aspirate back, so you can't really pull back to test contents or anything. You don't get anything in return. So this is primarily for feeding, and it's usually to rest the gastric portion of your system by inserting it directly into the jejunum. It bypasses it. You notice it's got all these little ports down here too. It's got a medication port, a feeding port, and a fluid port. A lot of people disconnect and just push through here because of the size of it, but I encourage when you can just push through the medication port to prevent them from hooking and unhooking as much as you can. It prevents infection. And then the replacement tubes. So we have the button tubes and the Foley catheters. The button tubes is what I was talking about before with that gastric tube where it just ends off in a button. Once again, you'll see this. You see it a lot in kids usually, but you'll also see it in elderly patients who've been on tube feeding for a very long time, or not even elderly, just adults who've been on tube feeding for a very long time. It's a better quality of life. It's a better form of feeding. And then lastly, you see here we have a Foley catheter. So this catheter, it's the one you insert into a urethra, but instead you'll just place it into the tract where the G tube was, and that can be used as a temporary setup until you can get a G tube replaced into it. And here's some references to take a look at. And that's it for the types of enteral tubes.